My guest at this time is former Oklahoma Senator and Congressman Dr. Tom Coburn. He's also a leading voice in the Convention of the States movement, which would amend the U.S. Constitution via a Convention of the States rather than starting in the halls of Congress. He joins me today to discuss where health care policy ought to be headed and where it would go if the U.S. pursued a single-payer system, which is being pitched by its supporters as Medicare for all. And Dr. Coburn, thanks so much for being with us.
I'm glad to be with you, Greg.
Well, when we spoke back in January, you mentioned that there were some fairly simple ways to bring down health care costs and expand coverage, and I want to dive back into those a bit more later in our conversation. But since we spoke, virtually every Democratic presidential candidate is embracing Medicare for all, with Senator Harris even admitting at one point that she wanted to do away with private insurance. We've seen some estimates that this could cost roughly $32 trillion over 10 years, so what is your reaction to the fact that Medicare for all or single payer is essentially mainstream now in the Democratic Party?
Well, I think all you have to do is go look at VA hospitals. You won't find one doctor who trained in a VA hospital who would send their family member to a VA hospital. And that doesn't mean that the people aren't good people that work there, but there's no accountability, there's no control, and there's no leading research to have best practices everywhere in the VA hospital. So that's the first thing, is outcomes will decline. The second thing will happen is we will have rationing based on age and condition rather than the patient's desire. And the third thing that will happen is that the quality of medicine in this country will decline. Remember, what we don't have today, which we need, which I'm fighting for immensely, is we ought to pursue and reward excellence in healthcare. And nobody can see that except very small groups that are trying to find the best place to get a certain outcome around the country. Why shouldn't we be able to know what the outcomes are and what the quality parameters are? And you're never going to get quality parameters until you get price transparency, so people will actually start looking. You know, the famed economist Milton Friedman said people spend money four ways. They spend their own money on themselves, their own money on somebody else's money on themselves, and somebody else's money on somebody else. And when you have Medicare for all, nobody cares what anything costs. And nobody really cares what the outcomes in terms of those delivering care. So if you think we can afford $3.2 trillion per year and we can raise taxes enough to cover that, what you're talking about is a declining economy, not an advancing. Now, the one point that they have right is that our healthcare costs in this country consume 20% of our GDP. And we have multiple studies by reputable groups that said anywhere from $500 billion to $1 trillion a year doesn't help anybody get well and doesn't prevent anybody from getting sick. So how do you fix that? You fix that with what was proposed by the Trump administration, calling first for price transparency for everybody in healthcare. Because once net prices are published, you're going to have 100,000 people making apps to show people how to get the best deal. And once you have price transparency, then you're going to have outcome transparency, because what will happen is all the prices will settle down to about the most competitive. And then the differentiating factor will be, what are your outcomes? What's your infection rate? What's your major complication rate? What's your average hospital stay for this? What's your reoperation rate? In other words, all of a sudden we will start buying health care like we buy everything else in the country. Now, who's opposed to that? All the hospitals, all the big insurers, all the drug companies, all the pharmacy benefit managers, and everybody else that's a middleman in healthcare that sucks money out that doesn't add value. And we have studied, there's actually a new book coming out by Marty McCary this summer called The Price We Pay. And it shows how pharmacy benefit managers rip off the very companies that hire them to save them money. So we have a lot of problems in healthcare, but they're simple problems. Everybody says, oh, it's so complex. No, the problem is there's no market forces controlling costs and outcome. And once you really have that, we're going to see costs go down about 25 to 30%. And what does that mean? That means 5 to 6% of our GDP is not going to be spent on healthcare anymore. Well, one of the reasons people's incomes haven't been increasing is because their bosses have been paying more for healthcare and have less money left over to give them a raise. So you'll see 5 to 6% of our GDP, or $1 trillion, available now for other employee benefits or for profits or for growth in capital equipment to grow a business. So this isn't complicated stuff, but everybody that's opposing it says, oh, this is so complicated. And it's not. And there's great examples around the country if you want to hear about them. I don't know if you do, but they're highly successful with great outcomes. And what we're seeing is lower costs and better outcomes.
Well, let's dig into that a little bit, because I want to talk about the chain reaction here. If there's price transparency and transparency of outcomes, as you mentioned, that obviously not only leads to lower prices, but probably leads to competition, which leads to further lowering of prices. But I'm sure folks would love to briefly hear how it's working in practice, not just in theory. How is this proving to work?
Well, there's one great example is a hospital over in Oklahoma City called Oklahoma Surgical Hospital. They publish all their prices up front. They guarantee their outcomes. They cover the costs of complications if there are any. They have phenomenal results because they concentrate on quality. And their prices are about 45% less than what you can get it done anywhere else. Now, how is that possible? First of all, they don't have that overhead of all the insurance industry and all that other stuff, because most of their customers come from out of the country or from workers' comp or locally in Oklahoma City. But they're a physician-owned hospital whose costs are about half what a normal hospitals are, because they're actually run efficiently, because the people who own the hospital actually want to make money off running a hospital. And then they publish their outcomes. So they know their focus is on quality. And their outcomes are almost superior to anywhere else in the state of Oklahoma. Well, how is it that they can be 45%, 40% cheaper and have better outcomes? Because the incentives are aligned to give quality at a fair price. There's a group in Tulsa that advises ERISA plans, large employers, where to get certain things done. Because they've gone and looked at outcomes and said you shouldn't get these things done here and you should get them done here. And because their outcomes are better, and oh, by the way, even though their outcomes are better, their price is actually lower. So we're starting to see the mechanism of price transparency and quality outcomes start allocating this scarce resource in a direction that gives us the best value.
Well, that's fascinating,
and that's what we want.
Because you mentioned before that hospitals and insurance companies and pharmaceuticals and pharmacy benefit managers, they're all interested in making more money based on people not knowing outcomes and not knowing what the actual cost is. But you're mentioning now that the transparency and outcome transparency is leading to profits. So how do you get the folks who are doing it the old way to see the benefit of the new way?
Well, you got to have price transparency. They got to have to compete. You know, I may have told you this story before. One of my favorite things is to go to a big city and in the middle of the night walk through the hospital employee parking lot and then go back at 10 o'clock in the morning and do the same thing. And you'll find 8 times more cars there. Well, they're not doing 8 times more work during the day than they're doing during the night. They're doing about 3 times. So what is this load of overhead that's being absorbed in all these big hospital chains? One is there's no drive for efficiency. There's no accountability for costs. You know, if you don't have insurance or you're out of network, you pay what's called their charge master price, which is about 3 to 4 times the price that an insurance company would pay for the same thing. And, oh, by the way, if you don't pay it within 30 or 60 or 90 days, they put a lien on your home. I'm talking charitable hospitals. Last year in this country, charitable hospitals made more profit than for-profit hospitals. Well, I thought they were in the business to help communities, not to make massive, massive profits. And yet, again, because things are not transparent on this resource, you have all sorts of capability for things to get muddled up. Let's just go back to your original premise: $32 trillion over the next 10 years for Medicare for all, right? So right now, with the Medicare that we're spending and the Medicaid that we're spending, we have $160 billion of fraud right now. What do you think it's going to be when it's Medicare for all? By the way, everybody talks about the opioid epidemic. Do you realize it wasn't until 2017 that CMS discontinued the rule that applied to every doctor in every hospital that if you had a patient that was receiving pain meds in the hospital, if you didn't want the hospital to get dinged in their reimbursement, you had to send them home with pain meds, even if they didn't need it. Nobody knows that. That's the government practice in medicine. So when it's Medicare for all, the government's going to be practicing medicine. And I want to tell you, the quality of care that they practice today stinks compared to standards. And so why would we go in a direction that gives us poor quality that's ultimately going to cost us a lot more, that's going to eliminate choice on the most personal things in your life? Why would we do that? We do that only because we embrace socialism and the elite should control your health care rather than the market. And so if you take the first premise, we could actually save $1 trillion a year in our economy by having real markets and real transparency. And, oh, by the way, FTC came out with an article just about a week ago. This is a Federal Trade Commission. Said maybe there's too much information for the American public if we publish prices. I want you to think, so the assumption of the pinheads in Washington is that we're so stupid we can't figure things out. And that's the base from which they start. Now, this is the Federal Trade Commission, who is supposed to be there to make sure we have enforced competition. And they think that they don't realize that some 16-year-old is going to say, I've got an opportunity in Tulsa to collect all this information and then sell it to people to get the best deal. When they have a laceration, which little outpatient center do you go to for a 4-inch laceration? If you go to a regular ER, you're talking $2,000 or $3,000. If you go to a small outpatient center that's competitive, you may pay $200 to get sewn up and checked out and get an antibiotic and a tetanus shot. So the whole idea is the elitism in this country now believes that we're not smart enough to be able to buy our own health care.
Well, let's talk about the elitism and what folks actually understand. There was a survey released by Axios just a day or two ago showing that among millennials and Gen Z voters, more than 73% support government-provided health care, universal health care as it's phrased in the survey, while 79% want to keep private insurance. But it's not just young people. 66% of all voters want government-running health care, and 86% want to keep private insurance. So what does that tell us about the difference that may exist between what people want and what they think they want?
Well, I think it goes back to tell us something totally different, Greg. I think it tells us that we lost control of education. We have the millennials, which is the largest group in America as far as demographics. There are 86 million of them. Approximately 75% can't tell you the 3 branches of the federal government. And they, as a group, embrace socialism without the knowledge or the history that 180 million people over the last 100 years lost their lives to socialism and Marxism. 180 million people. They have no idea that. So what they're saying is, I see a problem. The easiest way to solve that problem is have the government solve that problem. I don't want to be personally responsible. So we've lost the teaching of virtue. We've lost the teaching of personal responsibility. And we've failed to teach any history at all to 85 million young people in this country. How did that happen to us? Only 4% of universities now require a course in Western civilization to graduate. 25 years ago, it was 100% required that. What happened to us? Well, we lost control of the direction of how we should educate our children and what they should know. And the axiom, if you don't know history, you're bound to repeat it, is going to happen to us as Americans if we don't change this dynamic in our education system.
Well, I'm certainly glad to have gone to one of the colleges that does require that. Dr. Coburn, what's the best pushback? You mentioned the facts, the facilities that are pursuing transparency, and that would certainly be a model to hold up for those who don't want to go down the path of single payer. Republicans, when they had control over the past couple of years, didn't seem to be ready to hit the ground running on dismantling Obamacare. Do you think they're poised to competently rebut this push from the left? And if they are or they aren't, what's the best way to do it publicly?
Well, I think what you're doing is really important. You're informing listeners that there's another way to actually cut the cost of health care, and it's called transparency. Everywhere you have transparency in markets and price discovery and the transparency to see outcomes, you have lower costs. That's indisputable. Everywhere in the world, not just here. In every market in the world where there's price transparency and outcome transparency, you have lower costs. Where it's hidden, you don't. And the crony capitalists that now control healthcare don't want to see this change because they're making hundreds of billions of dollars a year in profits, not only off us and a decreased standard of living because we're not getting the raises because it's all going for health care, but also off the federal government. So I believe the answer is education, education, education. You know, in Tulsa, Oklahoma, well, this is something I've actually studied. That's where I reside. You can get an MRI of anything in an outpatient setting for $400. The cheapest in a hospital in Tulsa of the major hospitals is $2,700. You got to ask yourself, why in the world does it cost 600%, 700% more? It doesn't. But they can get away with it because you're captured. So if, in fact, you take all the outpatient testing that goes on in the country today and you start having real competition, you're going to save $150 billion next year. $150 billion just in 1 year, just on outpatient testing. So why wouldn't we do that? Why wouldn't we let people know what things cost? There's nothing else that we buy other than education and healthcare that we don't know the quality parameters or the outcomes and the costs. So why wouldn't we apply what we apply to everything else in our economy to healthcare? And what I put forward to my friends that the assumption is, they won't say it directly, the assumption is the American people are too stupid to buy their health care. What I put forward is, then you are too. You're too stupid to be up here. You're too stupid to be making laws because your assumption is that we don't have our own best interests at hand. And we do. And so what you'll see, and you'll see there's a group here called Medicis in Tulsa, and they help ERISA-based plans. They're saving them tens of millions of dollars a year just in Tulsa alone in terms of outpatient testing, telling them where to go and incentivizing their employees. We'll pay part of your copay and we'll pay your deductible if you'll go get it done here instead of at the big complex that's highly inefficient. And so they're saving tens to hundreds of millions of dollars a year for employers just here in Tulsa. My question is this isn't complicated. Everybody that wants it just like it is because they're making billions. You know, there's a health insurer in California, Blue Shield of California, that has $8 billion in the bank. It's a nonprofit insurer. $8 billion, really? In the bank? And they're nonprofit? If you look behind the scenes, the motivation for insurance companies is for prices to go up and costs to go up. Why? Because they make more money. Whereas when it's coming out of your pocket, the motivation will be, let's get the best deal with the best outcome every time. And once you get real competition in healthcare and real outcomes, what you're going to see is healthcare costs decline 25% in this country.
Well, it's one of the reasons why the insurance companies jumped on board with Obamacare, because they thought everybody was going to have to buy and that they would reap even bigger profits.
And that's why they're fighting transparency. And the big hospital chains and the nonprofit, they don't want transparency. They don't want you to know what things cost ahead of time. You might not come there.
And the Trump administration
it's not an insolvable problem. Is we apply what we apply to every other market and say, let's go for it. And once you do that, employers are going to start saving a chunk of money, and you're going to see it in your paycheck.
Thank you very much for your time today. As always, we look forward to having you again.
All right. Bye-bye.
Former Oklahoma Senator and Congressman Tom Coburn, also a leading voice in the Convention of the States movement. I'm Greg Columbus reporting for Radio America.